Hi guys, I'm Dr. Andrew Iraniha, and today I'd like to answer this question of what are the surgical options to repair the diastasis recti. There are several surgical options for repairing the diastasis recti. Obviously, the most common surgical procedure is called tummy tuck, or also known as abdominoplasty. During a tummy tuck, the surgeon makes an incision in the lower abdomen, normally in the bikini line, and separate the skin off the muscle all the way to the rib cage and repair the diastasis, and then subsequently reconstruct a new belly button. And at the end of the procedure, remove the excess skin and close the incision. This procedure often combines with liposuction to give the patient best aesthetic results. Another surgical option is called mini tuck or mini tummy tuck or mini abdominoplasty. This procedure is very similar to full tummy tuck, except the belly button is separated off the muscle and reconnected slightly lower to the midline abdominal wall muscle, which eliminates the scarring around the belly button. Another surgical option, which is very unique, is a laparoscopic repair of diastasis recti and tightening the abdominal wall muscle. This minimally invasive procedure involves making 3 small incisions in the bikini line, entering the abdominal cavity with a scope and special instruments, and repairing the diastasis recti from inside. This unique procedure offers less postoperative pain, faster recovery, and less scarring. And it also can be combined with liposuction for better final aesthetic result. It is important to note that while surgical option can be effective in correcting diastasis recti, they're not without the risk. It is important to discuss the risk and benefits of each surgical options with your surgeons before making a final decision. Overall, the choice of surgical option for correcting diastasis recti will depend on the severity of the condition, the patient's overall health, and their individual goals and preferences. Consultations with an experienced surgeon can help to determine the most appropriate course of treatment for your individual case. Well, in my practice, I have expertise in all different surgical options for repairing the diastasis recti, and after a comprehensive evaluation, the best option would be offered to my patients. If you're suffering from diastasis recti and interested in virtual or in-person consultations, please contact my office at 949-646-8444. Thank you.